The time to start a business in State College has never been better. We just got awesome rankings from a number of sources in the last year and a half. So State College was actually ranked in the top 15 places in the United States to live and launch a business by Entrepreneur Magazine. And 2 years ago, Bloomberg News ranked us the #2 tech hub in the United States to start a business without the downside of Silicon Valley. So this is a great, rich ground to start a business. And I think today when you hear from some success stories from some of our local entrepreneurs, you'll understand that we have all the ingredients locally here to grow our ecosystem. So first today, moderating our panel, we have Kelly Wylam. You've heard about Kelly throughout the day. She is the director of the Innovation Partnerships Program, and she is Pennsylvania's Sherpa through the SBIR forests, helping people navigate the challenges associated with SBIR. And joining Kelly, we have two business people that have been wildly successful with SBIR. We've got Maureen Mulvihill, President and CEO of Actuated Medical. She's been very successful in getting medical device-related SBIRs over the past several years. And joining her is Tim Hurley, who's the past president of Diapedia, a company focused on addressing diabetic foot ulcers. Tim is now a recovering entrepreneur, having moved to Penn State 2 years ago as a commercialization strategist in the Office of Technology Management. So please join me in welcoming Kelly, Tim, and Maureen as they talk about secrets of SBIR success.
Okay, good afternoon, everybody. I'm glad you all decided to stick around. You heard a lot this morning from the different agencies and about their differences and what makes a good proposal on the surface, and sort of general nuances about the different programs. And as James has said, we're lucky to have with us two of my colleagues who now I've known Maureen for a majority of my career. Since the Innovation Partnership was started, and you'll hear more about that in our next session after this one. And then Tim Hurley. And as James said, Tim is the Senior Technology Licensing Officer and Commercialization Strategist for the OTM here at Penn State University. So along with that, you know, he wears a couple different hats because he's been extremely successful in his business life and 20 years leading technology startup companies, and the companies he has worked with, Diapedia, as James mentioned, and another company, Expansion Technologies. They've received millions of dollars in SBIR and STTR, SBIR awards specifically, not STTR awards. So along with his role here at Penn State University, he's able to come at his counseling assistance and value add of having worked in industry and receiving these awards across many years. And then Maureen, as I said, I've known for a good amount of time, and she comes to us with many accolades from the federal level and national as well as worldwide recognition for her company and their ability to move their innovations from infancy using SBIR and STTR through to commercializations and having widely commercialized many of her products. She's also an alum of Penn State University. So with that all being said, I think you can tell they're both, and her company as well has received millions, not hundreds of thousands, millions of dollars in SBIR awards. So if we had anybody that we wanted to tap into their knowledge base of advice and experience, it would be these two folks here. So we're going to ask a few questions, and actually I'm pretty sure that between the three of us, these few questions, we could all speak for about a day on them. So we're going to have to keep watch of our time, but we'll leave some time for you to ask some questions as well. So one of the big questions that we get is with all the agencies that were here and presented this morning, there are 11 different federal agencies offering all these different programs. Really, how does entrepreneur or a researcher who's being entrepreneurial and spinning out an innovation or technology, how do they find a match? How do they start with this process to try to explore SBIR and STTR to find the right fit?
Sure, I'll start. Are we on here?
Okay.
I'll start with... How's that? Okay. Expansion Technologies. We started that company in about, it was the mid-2000s, maybe 2007, 2008 timeframe. And the technology was a synergist, a plant protein that it was thought might help conversion of certain feedstocks into biofuel. So we were aware of that technology on campus, and it happened to be at a time where research interest in biofuels was very high. So we were able to survey the various agencies and find research topics addressing conversion of cellulosic feedstocks into biofuel across several agencies. So that was the strategy for that company, was to start with the initial funding source to support this early stage research. And then we reached out in each agency to the program people who were responsible for that particular research topic. So we had those conversations, and in every instance we're encouraged to pursue a phase 1 proposal. So we were able to do that and secure phase 1 awards from 4 different agencies, addressing different aspects of the development of that technology. So one of the keys is having that discussion very early on, I think, with the program folks and developing that relationship and getting their feedback as to whether or not the technology does meet that specific need, and if so, then putting the team together to put together a good proposal. But that's just an example of...
Would you say that the earlier you're able to have that conversation, the better it is, because then you can move along to another agency or another program manager, and if it isn't a good alignment with the first person you talk to at NIH or that agency, would they refer you to a colleague of theirs if they knew it was a better match?
Well, I'll just address expansion, and then maybe Maureen can jump in. But yes, exactly. At DOE, in that early stage discussion, we were then partnered with the National Renewable Energy Lab as a result of that contact, and we're able to involve them, from the jump in helping to provide us with certified feedstock that was already characterized and access to all of their testing facilities as well.
So going back to the question, where do you go? So everything's online, and where Tim was talking about how he had a specific idea and he wanted to see if it fit any of the goals of any of the federal agencies. So there's 2 ways to look at it. Do I have a product, and do I need to get that funded, or do I have a technology, and what applications does that go forward with? So if you have something that's medical and you have a technology or a platform, then you want to look at NIH, and you want to look at all the different institutions at NIH and see where your technology fits. One of the devices we were doing for pediatrics, so we looked at the pediatric institution. But if you have like a platform technology and it's not medical, you might go to National Science Foundation, where they like to fund platforms. They like to have you do that early development. But if you have something where you have a focused target that's for a DoD application, then you'd look at the DoD SBIR website and look at all their solicitations, and then you would call that program officer and you'd say, look, I have a technology that fits what your call out is, and then you discuss that with them. Now, you don't want to do it 30 days before the grant is due. You want to do this maybe a couple months before the grant is due, because there's a period where they're not allowed to talk to you. But it really is, do you have something that has an application specific to an agency, or do you have a really great idea? And if it's in the medical field, then that's an NIH program, or if it's some sort of platform technology, then it might be an NSF project. But if it's DoD, they want you to solve their specific problem. Or I think DOE is similar to that too.
DOE is-
So it's really, you look at all their websites and look at what they're doing and then see where you fit. And it takes some investigation. It's not like you write this grant and you turn it in and it gets funded. It's a very long process to develop an SBIR because you need to find the right place where it fits, and then you need to write a very succinct grant.
So just to springboard a little here and dig a little deeper into that. So Tim, so working with DOE, there might be some overlap or some interest with a technology that might be applicable to DOE as well as DOD. Is it possible that if you're developing your proposal for DOE that you can sort of just copy and paste from one proposal for one agency to look to apply to another agency?
No.
Okay.
No.
All right.
You need to have,
Should somebody anticipate that, that they should not ever be considered doing that?
yes, you should definitely not do that. At Expansion, we had completely different aims, topics, and in some cases, different technology that was being applied, to each of those grants. One, we were able to work on scale up. Another, we were able to look at different types of feedstocks. So the research focus and the technical work plan must be separate and distinct.
Correct. And in our case, we have an intellectual property portfolio, vibrating needles. And so with NIH, we had a bone access device, we had a spinal access device, we had an epidural access device. But each one of those has a different application, each one has a different transducer that has to be put into that device. Everything is different. And so that's why it was okay to do that with NIH. There is a little checkbox when you put a grant that says, have you submitted this exact work for somewhere else? And so if you do an NSF and an NIH or whatever your examples are, and the NSF gets funded, then you have to turn down the NIH money. Or if you get the NIH, then you turn down the NSF. So you could do it, but you got to check a little box that says, yes, you've done it. You have to be above board on that.
Yeah, I found also it's also helpful somewhere in the intro area of your proposal to either of those agencies to add that one sentence. We have submitted a proposal for this same work and project to whatever the agency is. That just puts everything out there and above board if somehow the checkbox is missed in the review process. So you need to be aware and disclose things that are important. And I've found it's probably not as advisable to try to do that, to submit the exact same project to two different agencies, because it tends to look like you're just spitballing and throwing it at the wall to see what sticks, and that you haven't reached out to each individual program manager at the agency. Otherwise, you would have decided which one was the best because they would have given you that indication. So really, that's not a wise approach, we would say. Moving on to sort of a next question is that as we're talking about these proposals and how they're being developed, what exactly do you think some elements of a successful proposal are? And then sort of a two-for question. Since we probably have a number of folks from academia here in our audience, it might be helpful for them to gain an understanding some of the differences between an academic research proposal that they may have had tons of and been successful with versus what an SBIR is and what it means and how they differ.
Sure. So to take the first part of that question, so with an NIH or an NSF, it's hypothesis-driven research. So you have to come with a measurable hypothesis. You can't just have a great idea. You need to be able to measure that idea and show success. So it's a very research-oriented structure for the NIH and the NSF. But at the end of the day, you have to have a commercial plan. So even in a phase one, you need to have a couple sentences that say, this is going to be commercialized via distributor model, I'm going to sell this myself, or I'm going to sell this off, it's going to get acquired. You need to have an idea what the commercial end game is for your technology. or you're just going to sell it yourself forever, whatever. But you need to know what you're going to do. Where in R01, it's kind of for research. So you have a hypothesis and you have your structured aims, but you don't have to have that end commercialization piece, which makes it different. If you're doing a DOD or a contract type proposal, it has a totally different structure, but you're really talking about how you're going to solve their problem and how your technology solves their problem. But also, at the end of the day, you have to provide the evidence that you can be successful and deliver what you promised to deliver.
Great, that's great advice. Go ahead, Tim.
Yeah. So a couple of things. I think across the two companies, our hit rate on phase one was about 90%, and that's pretty high.
That's very high.
Yeah.
Yeah.
So what did we do? Well, we talked to the program people, so we knew that we had a technology that met a program objective. We read the solicitation, and I can't stress that enough. You need to read every word of the RFP and make sure that every box that's there that you check it.
So you would say that reading and following instructions is an extremely vital and important aspect of the SBIR process. Is that what I'm hearing you say?
I might not be the smartest guy in the room, but I can
Okay.
follow directions.
All right.
And yeah, so you don't want to leave any area of the application. You don't want to miss it. And if you have questions on, particularly phase one, if you've not submitted a proposal before about what they're really looking for that requirement, ask the program people. But the solicitations tend to be very detailed, and they can walk you through the application process.
Can I make one note to that?
Sure.
So when we started doing that, we have two monitors. And so you have the application on this monitor, and this monitor you have the directions.
There you go.
And you
Excellent.
go down the
Excellent.
directions, and you make sure on the application you're doing exactly what they want you to do, so you don't miss any of those boxes. And even when you're doing your budget, it's the same thing. So I totally swear about you need two monitors. I even joke I might need a third one, but two monitors.
No,
actually is
that's
very
excellent advice. That makes perfect sense. Yeah, that's great.
helpful. Go ahead, Tim.
Yeah, sure. So again, what did we do that may have helped our odds? I looked at the teams that we put together, and at Diapedia and at Expansion, we had researchers who were really world-renowned in their areas. And Diapedia, it was biomechanics, and specifically biomechanics of the foot. With Expansion, it was plant proteins, and the researcher had discovered these proteins, had named these proteins, and as a result was in the National Academy of Science because of that. So we had the strong technical team members, and then we had business people that had started companies previously. So the team was strong, and I know that that's certainly one of the criteria that the review panel is charged with, is assessing the quality of the team. The aims that we had, particularly in phase one, we tried to keep them to two specific aims, and really try to address those two aims and be very clear in why those two aims were important at phase one in order to advance the technology toward a phase two and the next stage of commercialization. And then finally, just letters of support. Even at phase one, having letters of support from a third party, it really does a couple of things. First, it's an independent validation that somebody out there has looked at what you're doing and supports it, and that's just important.
Now, what does a
have.
letter like that look like? Or what would a letter like that sound like? Because I get asked that question a lot. I mean, does it have to be, if you eventually commercialize this, we think we might buy it? Or, I mean, was it,
Depends
what
who's
is that?
writing it.
Yeah.
So say it's a clinical application, it's a doctor who says, yes, that technology is needed, there's nothing else out there. One of the devices we recently worked on is for an upper GI device, and there's really no literature out there that says it's a big problem, but any GI doctor you talk to is like, oh yeah, that's like the bane of my existence, that's a horrible problem. And so really to support the significance of that problem, we had 5 or 6 GI docs write us letters, and they talked about how they had a patient who they couldn't treat that situation, and so the patient died. So those kind of stories, if a doctor put them in a letter. that helps. If it's a company, maybe the company's looking at it for future. My distributors, they write us letters saying that they would love to distribute the product once we're done,
Okay.
that kind of thing. So it really depends on who's that letter from. We're putting in a grant right now, and we have letters from all of the partners that are subawards talking about what their problems are and why they want to work with us. So it really depends on who that is, who's writing it.
So you're a well-oiled machine when it comes to SBIR and STTR. Some of our newer folks that are just getting off the ground with their innovation, some of this is intimidating. They might not know where to start. They might not know if they want a potential customer, or they want a doctor, let's say, sort of to, certified that, yes, this is a valid problem and issue. Is there any guidance you can give there to somebody, that's a little bit intimidated about where to start?
Well, it's all about customer discovery, right? So
right.
no one's going to fund you to do something if there's not a problem. So it's really on you to figure out if there's a problem and how you're going to solve that problem for them. So that's your first step. So being timid is not going to work out. You're going to have to find out what your problem is. I'm not boasting for any consulting firms, but there's a consulting firm and they have a class that's structured on how to frame an NIH or an NSF, a hypothesis-driven grant, because prior to this, all of the work I had done with SBIRs were on the DoD and the Air Force side, that kind of thing. And so taking their class many times to understand how you would write a hypothesis-driven grant was very beneficial to Actuated. But there are other consultants out there, I'm sure, but really just learning how to do that and write the measurable claims. So I'm also a reviewer for NIH SBIRs. That's kind of my give back. And and one of the major things I look for is when they give me their aims, are they measurable? When they give me their hypothesis, is it measurable? Don't just tell me you're going to do this. How are you going to prove that you're successful at it?
You asked, how do they go about contacting people, determining who might be able to provide a solid letter of support. Maureen says customer discovery, and that's exactly it. And I will say ICOR. And I know that you probably heard about ICOR earlier today. That it's a program that's exclusively focused on customer discovery. And the various opportunities with ICOR, whether it's at the national stage or the local stage through some of the initiatives we have here, will allow you to go out and have that face-to-face interaction with potential customers and learn what their pain points are and develop a relationship with maybe one or more that understand your technology and how it might help them and provide you with a letter of support. So as a reviewer, and I've been a reviewer as well, you see a letter of support comes in, it tells you, well, this applicant's, started to do their homework. They're out.
Right.
Not only have they got a letter validating the technology, but they've taken the initiative to go out and talk to a potential customer.
Excellent.
And I would say back to the ICOR. So last week or the week before, there was the Invent Penn State, and a couple companies had pitched their technologies, Penn State companies. And so I said to one of the companies who's actually in the audience, when you do your ICOR, I can be one of your interviews. And that was kind of surprising. So if anybody in the audience is doing something where they're doing an ICOR program, you have to get a lot of interviews. But, I'm open, or I can find somebody Actuated to talk to you if that's, something you want to do. Just putting it out there. We're close. We're only 6 miles down the road. I don't think we talked about that.
No,
Actuated
right
is actually
here.
in Bellefonte.
Yep.
So we're pretty close.
Okay, so I think we probably have one more question here, and then if anybody has any questions in the audience, we'll entertain those. So we've talked about how you get started, how you find your path to the right agency or topic area. We talked a little bit about what a good proposal should include and look like and how you need to approach it. So let's say you did all that and you have success. You got your phase one. Now what? Now what do you do? I mean, I know that when I'm counseling clients, I typically tell them, and there's a part of our preparation process where we say, you really need to allude to the fact that you're going to be seeking a phase 2 and allude to what your phase 2 work may be and entail based upon this phase 1 work. So it shows them you've thought ahead. But talk a little bit about that and how you make that transition and some of the nuances of possibly gaps exist in the funding there, or the research or the work that you're doing.
So I can say that Actuated Medical is probably one of the few companies that got to the FDA on National Science Foundation, SBIR funding, so phase 1 to phase 2. So during the phase 2, then we had to raise a certain amount of money to get to phase 2B with NSF, but we got to the FDA. And people say, how did you get to the FDA on a National Science Foundation funding? And I said, because as soon as we won the phase 1, day 1, we started planning how we were going to commercialize that product. Now, I'm not saying that that's exactly what we did, and that's how we commercialized it way back here, but we started thinking about how we were going to get to the end, because the SBIR is all about commercialization. About 20% of the companies that get SBIR funding make it, and you need to start talking about it and thinking about it early on, because everything you do is going to cost more money than you ever thought, and it's going to take more time than you ever thought. So start planning super duper early. And even for us, with NIH, you get like just in time, like say you get a score and you start getting kind of, send us this information, send us, all the different things that you have space that you lease, all these different things that NIH needs or whatever the agency is. At that point, we start planning on how we're going to take this to market. And it's so important to really have that planned out.
Yeah, I would agree. The commercialization plan at phase 2, for instance, at NIH, it's 12 pages, and I think the research plan is 12 pages. So it's equally important once you get to that point. Back to Maureen's point about phase 1, and this is what you said you were going to do, and maybe you didn't do it exactly the way you said you were going to do. That's fine, but explain why you did the pivot. What caused you to change from those aims that you originally had and move in the direction that you're moving toward? So, be able to explain that. And then something I think often gets overlooked, but it becomes very important at phase 2, is the intellectual property, and making sure that really as you start in the phase 1 work, that you have an idea and a strategy about intellectual property, if it's going to be important to your business and to the product, to protect it through a patent, that you have a strategy there and that you're moving on that strategy, so that you don't wait to phase 2 and then get to a commercialization plan and then you get a question from a reviewer like, do you have a license to this? Do you own this? You're not going to get very far down the road with the commercial reviewers at that point. So pay attention to the IP.
So a question for you there. I know we deal with a lot of folks that are first-time applicants that are spinning out their innovation or their technology from the university, and with the hat that you wear for the university, shouldn't it be really one of those first discussions that's had with the university about the interest in commercializing to kind of iron those terms and conditions out in advance?
Yes.
Sometimes it's a little more difficult and you have to submit anyway, but you say you're in negotiation or pending or something.
And some agencies may require you to show evidence of the license
Right.
before you get the award. So, they're going to force you to address that. Not all agencies are going to operate the same way.
But
though.
it is wise to do that earlier, the sooner the better,
Yep.
and obviously not really wait till the phase 2 to try to.
And there might be
get
some
that.
licensing officers back there that could raise you could start that conversation today.
Okay, if anybody has any questions, feel free to step over to the microphone. If anybody can answer them, these two folks can.
I'd love to hear just your experience. I know the difficulty for a lot of companies is there's plenty of companies that'll start with the SBIR funding, and then the challenge is figuring out how to play that how to make that transition to commercialization, not just for the sake of satisfying the requirements of the grant, but also figuring out just, the challenge of all the timing of trying to grow that company and keep it afloat while you're making that transition. And so hearing just any advice that you can have for any of the companies that are out here that are pursuing this, that are going to be coming at it where like SBIR is a big chunk of their initial funding, what advice do you have in terms of trying to bridge that gap from grant to being able to support your company off of product revenue?
Great question, Scott. So we've done a lot of debt financing. We've been invested by Ben Franklin, so there's economic development funding around. One of my best stories is Blair County ABCD Corp had a $2,500 micro grant. We got the micro grant. We funded some Penn State research. That research got us a phase 1 SBIR. That research then got us a phase 2 SBIR, and that product's on the market. So it's just, you look for every little nook and cranny where there's funding. The venture capitalists are out there and the angel investors are out there. It really depends what's your business plan and how you're going to get to market. But there's lots of different people out there interested in investing in entrepreneurial companies at different stages. And John Sider's going to talk in a couple more minutes, and he'll have some advice, perhaps. Yep, he's going to have some advice on that. So listen to John when he talks. But it really, we've done a lot with debt, a lot of personal financing. We've done angels. None of my angels are local, though, but I do have angels from San Francisco and actually United Kingdom and Chicago. So it really just depends.
That's neat. So it sounds like diversity of a lot of different strategies so that, like, as it takes longer than you expect or if it takes more, then you're right. Cool, thanks.
And that's why Actuated is still here, because our revenue and our funding is so diverse. If we just did venture capital funding, we would have been gone a long time ago because MedTech takes such a long sales cycle.
So don't put all the business's eggs in the SBIR basket.
Or in the venture capital basket.
Right.
Be
right.
diversified.
Great, thanks. Tim?
Yeah, so it goes to your business strategy. So our approach to these new businesses was to move the technology to a certain stage and then transfer it. In the case of Expansion, we were successful in that initial funding through federal sources. As we approached phase 2, natural gas took over, and there was no interest. The interest in biofuels just disappeared. There was no venture money. We were talking to a couple of biotech firms in the space that had connections to VC funding, and it just went away. That's bad timing on that one. In the case of Diapedia, we started discussions very early on with potential licensees, so companies that could pick up on where we had taken it, and eventually we found a licensee, to take the technology. So that was the strategy that we had from the outset.
Great, thank you both very much.
In the interest of time, we'll only be able to take one more question now.
Okay.
We've got a very packed schedule, so thank you.
Hello, I'm Lisa Kaplan. I'm a nurse. I've been a nurse for 30 years, and my son and I, who lives in Maui, Hawaii, we invented a device that's an alternative to wrist restraints for critical care patients. So I have absolutely no idea I've looked up grants, and I can't find a grant which has anything to do with physical restraints. So I'm just wondering if you can help. I mean, I'd love to move in with you guys. That would be my first question if I could. But if you could
talk about that later. Yeah.
If you could help me just to begin, or where to begin.
Right.
I've looked up grants and I can't find anything. So
we need to find the institution at NIH that funds that. So elderly care or rehabilitation.
And it's actually for critical care patients is what it was be specific.
So Rob, do you want to comment on what institute that would be? Nursing. Yeah. So I'll give you my card when we leave, and then we can chit chat later.
And I can also help through the Innovation Partnership to help guide you through the process, and we can talk through things and how I can help coach you and move you along the path.
That'd be great. I mean, it's wonderful being a nurse. I've loved my career, but I have no idea how to do anything with business, which makes it challenging. I appreciate it.
We have all kinds of resources for you here.
Okay, that's great.
Absolutely.
Thank you so much.
Let's That's probably a good segue to our next panel, but before we segue, please thank our panelists here.